Good afternoon, everyone. I want to introduce myself. I'm Yvette. I'm the co-director of the Molly Wardaguga Research Centre, and currently I'm on the beautiful lands, excuse me, of the Yolngu people here in Nhulunbuy. So I want to show and demonstrate my respect and acknowledgement of the thousands of centuries of sovereign lands that we're on here. I am probably one of the furthest places in Australia that is so far away from Fran, who's on the other side, closest to the bottom of the globe. I want to acknowledge our guests, it's Fran, but also I want to acknowledge our participants who are registered for this afternoon's talk. Thank you for your time. We invited Fran because I saw her present in Sydney at the end of last year, and she gave such a heartfelt, passionate, insightful presentation that working in the field of mothers and babies, I think it was really important to share the message that she had learnt during her career as a student, but more so the career that had been built on years of as a clinician, as a mother, as a traveller. And, Fran's going to share some wisdom, some humour, some insights and some ways forward. And although she mentions that she's a PhD candidate, she's actually a well-travelled, well-wise and very funny woman. So I'm going to hand it over to Fran, who's a special guest this afternoon. Over to you, Fran.
Kia ora, Yvette. I hope you can hear me okay. So tēnā koutou katoa. No ingarangi ahau ke noho ahau ki te whanganui a Tara. Ko au te mama o Lola, rawa ko hati, he tangata tariti ahau. Ko Francesca Storey toka wingara. So thank you tēnā koe, Yvette, for your lovely words. I loved your description. I might play that back. But also the invitation to share this. And yes, it was a really good opportunity to share this back in December. It's strange to be doing this virtually. So hello, everybody. Lovely to meet you. Now, this concerns non-Indigenous researchers and Indigenous methodologies, but in particular context, I'm talking to my experience here in Aotearoa New Zealand, but I'm hoping this might be relevant for others working in similar fields, and there might be different takeaways because we're all here to seek the elimination of inequities. I'd like to pay my respects to everyone joining this seminar today and those who've informed it. So welcome and haere mai. And there's nothing like a little technical glitch at my end where your computer decides to reboot just as you log on. So I'm cheating this a little bit with notes instead of working off notes on the screen. So I hope I'm maintaining eye contact with you wherever you are. So can you see my change of screen? Yes, it's worked. So ko waio, which literally means what waters am I of? So who am I? So I just spoke to you very briefly, trying to use some Te Reo Māori, the language of Māori people here in Aotearoa New Zealand, but the way in which I introduced myself was trying to reflect the traditional, what's called a pepiha, which is essentially an introduction which seeks to find common experiences, common ancestors, common tribes between us, and being, as I spoke to in that, non-Māori, and being really clear that I talk to myself being tangata tariti, and I will talk to you about what that means to me and others. I was explaining to you that I'm non-Māori, working and living and being a citizen of Aotearoa New Zealand. I'm from the UK originally, from England, but I've been here in Aotearoa New Zealand for about 20 years. I'm mum of 2 young girls who are hopefully behaving themselves wherever they are in Wellington City right now, called Lola and Hattie, and my name is Francesca. And essentially what that's about, and it would be way nicer to be able to do this in person, is to be able to find those common connections. Maybe you have a daughter called Lola or Hattie, but it's about finding those similarities and building those relationships between us. And that's important. And I'm sure that's important to all of you in the work that you do. It's certainly really key for the work I'm involved in and what I'm going to talk to you about today. So the kaupapa, meaning the work or the study, what it is I'm talking to you about. This is probably the most heavy duty, boring slide. Araha mai, sorry. But this is, it's not a detailed methodology of the work I've done to date, or even an analysis of some of the qualitative data I've collected. This started as a master's research. And this, at the beginning, was an opportunity for me to learn from my experiences being non-Māori in a research group which conducts predominantly kaupapa Māori research, which I'll talk to what that means. But I wanted to understand and explore what those experiences meant and what they might mean for other people looking to do similar work, but really looking as allies to do good and to seek changes in our inequitable outcomes. So this has been overseen by Kaumātua. So Kaumātua is a description of knowledge holders, of elders that we work with here at the centre, and they very much informed and helped shape what this study would look like. And essentially what I realised is I was examining the role of an ally, of an accomplice, but as the work proceeded and as we were lucky enough to get to know the other research centres around the world, Yvette, Sue, Sophie and others, I realised there were similarities that could be learnt for and could be shared for our other international allies. And it provided an opportunity to kind of expand on and develop this into a PhD. So the background, the why, if you like, the why am I doing this? As Yvette said, I'm a nurse by training. I'm a neonatal nurse. So I started off in emergency nursing, intensive care. And once I moved across to Aotearoa, I became a neonatal nurse. So that's, the small babies, as we all know, the babies that we don't want to see ending up in that intensive care unit environment and that trauma environment, which also is a traumatic experience for whānau, for families. And I was in NICU for probably about 12 years before I moved across to research. But in that time, it was, for me, I was becoming really conscious of the overrepresentation of Māori in the neonatal care units. And more particularly the experiences for whānau Māori whilst they were in our care. I was a charge nurse there, so often I was the one who was responsible for justifying our very Western influenced and restrictive visiting policies and the rules, and an observer of what can only really be described as racist experiences and interactions at times. And so I had the opportunity to step away from that. I used 12-hour nights just as the excuse as to why I wanted to try something different. But there was an opportunity to join this research team led by Professor Bev Lawton. We're at the Te Tātai Hauora, Hine, the National Centre for Women's Health Research, Aotearoa, here at Victoria University in Wellington. And that was an opportunity to be involved in a study that was called SAM Kids. SAM Kids, as on the slides, followed a study that was called SAM. Both these studies were about exploring potentially preventable morbidity for unwell women. So potentially seeing whether there were ways we could have seen avoidable harm and severe illness for sick pregnant women or recently pregnant women. And the follow-on study, the SAM Kids, was to ask questions around whether the unwellness and the morbidity experienced and unfortunately mortality in some cases for the pepi, for the babies associated with the mums who had been cared for in either intensive care or high dependency unit in Aotearoa in 2014, whether that could be determined by a large multidisciplinary group as potentially preventable. And this was a unique experience for me in a number of things. One of them was being a nurse in a room with different representatives from the disciplines orientated around health, which for many of you, if you're involved in health, we know that doesn't often happen. So this meant we had midwives, nurses, GPs, obstetricians, anaesthetists, intensivists, talking about the cases that were all de-identified. And what we wanted to ask the questions around, as I said, was this potentially preventable? But we wanted to understand the factors with that. But what was really exciting and refreshing to me was this incorporated approaches to remove possible bias. Ethnicity was taken out of the case reviews as we went through these cases. And it was with an Indigenous lens, a non-deficit focus, and it involved Kaumātua in the preventability reviews. And this led to a very different and unique way of exploring unwellness for pregnant women, their babies. And 50% of these cases were for Māori, 50% of these cases were for New Zealand European, but the panel members didn't know this. What was exciting about this was the Health Quality Safety Commission here, which are associated with our Ministry of Health, they took on this way of working and this way of exploring whether we could do better, whether the system could do better, and whether clinicians could do better and potentially prevent harm that was experienced by these wahine, by these pregnant women. And it became business as usual by the Ministry of Health. for me as a neonatal nurse, I had felt that I just had impact one-on-one with families that I was looking after in NICU, with the babies, with the staff that I might be working at the time. And as much as I loved that, and I felt that I could impact and support the best outcome possible, it doesn't change the system. The policies don't change. And as much as we love those 23, 24, 25 weekers, all those babies, they just keep coming. And they certainly keep coming at 3 o'clock in the morning. And so suddenly I found myself in an environment where this research was actually pushing for change. It was going to inform policy change, and it was going to inform transformational change. And I was lucky enough to be hooked. So kia ora, Bev. I think you're hidden on this somewhere on this Zoom. So from that work that I've just described, the SAM and the SAM Kids study, I had the opportunity to continue working at the centre and became a project manager for a study called He Korowai Manaaki. Now, korowai is the name for the traditional woven cloak. So we're imagining something that's a protective cloak in terms of that reference. And manaaki means to protect, to nourish, to nurture. So this was a study that was around establishing a wraparound care. So much similarities with the birthing on country work of Yvette and all of you on this that we've heard from. This was around wraparound care for whānau that would support the mama and what the mama wanted. So this was not just evidence-based care and timely care. This involved support for oral health, for accessing scans, for support with access to driver's licensing. But excitedly, it was informed by the iwi. It's in partnership with Ngāti Pāhawera, a Māori tribe in the area that we were working in. When I say remote New Zealand, it is not remote, as most Australians know remote. But it was a small, discrete population who had invited the centre to do something different for Hapu Mama, work in a different way with pregnant women to try and support better outcomes and care that they wanted in the way that they wanted. And this was Kaupapa Māori research, which is research that is by, with, for, and as Māori. And I acknowledge my position coming in as a project manager, not just being non-Māori, but not being of Aotearoa New Zealand. I'm a British immigrant. And so through that time and those experiences working with both the researchers, Māori clinicians, providers, and the Kaumātua, this was a unique experience and one that I was really privileged to be in. But I think the description of that study here, this was evidence of culturally responsive research, where collaboration with iwi promotes strength-based approach to improve outcomes. This was something very, very unique to me. I want to just acknowledge here Harlem Cruz Atarangi Ihaya. She's Ngāti Kahanunu Ngāti Porou, and she's a whananga, a relation of Kaumātua Matthew Bennett, who some of you may have met through our previous engagements with Yvette and the team. But she allowed us to put her beautiful hapu pregnant self in relation to this project. But what I learned very quickly in this time was this was strength-based. All I'd ever really known before joining the centre as an English neonatal nurse here in the capital city of New Zealand was mostly deficit discourse in relation to the experiences for whānau Māori. And that's likely typical of other non-Indigenous NICU nurses around the world working in similar countries who are used to this reporting of our inequitable outcomes. So in relation to the work I speak to of today and the work I'm looking to do and continue to hopefully inform, it's best summarised in response to a very famous Māori proverb. What is the most important thing in the world? He tangata, he tangata, he tangata. It is the people, it is the people, it is the people. And many of those people are pictured here. Many of them are also probably on this Zoom, although I'm not even going to look at who might be on. But I really want to just highlight this was a really significant meeting for us in terms of our work, but also in our partnership work with the team for Birthing on Country, with our colleagues in Canada. And unfortunately, Yvette, Sophie and Sue weren't able to be at this meeting, which was held in Vancouver just before Pridoc. They may well be on the Zoom picture, but I would just like to highlight our friends and colleagues, Elder Mabel Horton, gosh, who have we got? I'm trying to have a look at the thing. This is where I went wrong. We have, as you'll know, Associate Professor Lisa Wapp, there's Janet Smiley. There's many of our team from there on that on that photograph, but it's just a way of capturing these are the people that we're working with to all change the systems. And that's been a constant informer and motivator of some of the work that I'm looking to do. And who are we? We're Māori and non-Māori, we're Indigenous, non-Indigenous, we're clinicians, researchers, community members, family members. We're supported by a kahui Kaumātua, a collective of elders and knowledge holders that help shape and inform and guide the way in which we work. And this is, as you will all know, the term research, what we used to say research as activism, and Yvette Rose says research is activism. And we've come together to try and build on our relationships and build on the momentum that we have working together. But I think the thing that's just constantly a driver and a motivator in this is recognizing that when we talk to the disparities in outcomes and what we're all looking to change, it's often reported without any associated context about how the disparities arise, and it isn't necessarily attributed to their root causes, which we know as racism, unwelcoming health services, and the impact of colonisation. And whilst I was interviewing in relation to the masters, non-Māori working in similar ways, as described by Kaumātua Matthew Bennett, working successfully in a way that's acceptable to Māori and that moves beyond the traditional way of researching, I could see similarities across our global group of researchers. And some of you are here today, and there are many positive disruptors on this group. And this became an opportunity to expand the study to become a PhD, which I'm keen to capture. So I detailed briefly in my pepeha, in my introduction, he tangata te riti aho. And what I was highlighting there is I'm a person who was here in Aotearoa because of Te Tiriti o Waitangi, which some would describe as the first immigration document. It was the settler document that enabled non-Māori to come to Aotearoa and build. But to be a person of Te Riti, when people are acknowledging that, is to say that we're building a relationship with Māori, and we're maintaining and growing a relationship. And it's to understand how this nation was developed and impacted. But it's an intentional expressed mark of a respect to Māori and the fight for Māori self-sovereignty. But I also am careful to say, let's not sugarcoat it. The way I'm speaking to it now may be very different to many others I know in Aotearoa. And not surprisingly, there are debates around whether non-Māori, whether they define themselves as tangata te riti or Pākehā, settlers with an ancestral history here, can do or should do or walk alongside kaupapa Māori research. So put simply, by not being Māori, I don't have the authority conferred by whakapapa, by genealogy, put simply, to contribute to Māori thought and practices. Some of you may know the work of Dr. Fiona Cram, Ngāti Pahawera, and are fortunate to work with her early in some of this research. And she describes how walking with and working with is the role expectation that should be understood by those invited to be alongside kaupapa Māori research. So I'm very clear I cannot do kaupapa Māori research, but my interest is around how do we support those to walk along safely, effectively, respectfully, but actually to contribute to those necessary system transformations by working in this way. Reflecting on the renowned Professor Linda Tuawai-Smith's description of 7 ethical principles and the values to guide kaupapa Māori engagement, we know that it's a respect for people. It's the importance of the seen face. And this is virtual, but it's not the same as kanahi kata kanahi, which is in person. Looking and listening before speaking, sharing, hosting and being generous, being careful, being aware of others, not to trample over the mana of others. And I think most importantly, kia mahaki, being humble. And to date, in previous work and the early stages of this study, like I said, I can see really clear common approaches that many allies, as I would describe them, or accomplices, have in the way they're working with Indigenous leaders and Indigenous methodologies. But I wouldn't be here if it wasn't for the support of the Kaumātua, the elders and the centre staff that I work with. And whilst I talk to it very positively, as researcher Alison Jones cautions, even for kaupapa Māori researchers open to working with non-Māori, engagement requires justification and care. So I'm proud to say ko kairangahau aho, which means I'm a researcher. But I did really struggle with that, having moved away from my identity as a nurse. It's that part, if you're lucky enough to be able to travel and you have to fill in your occupation, and I feel a bit of a fraud. Do I write researcher? I can't write academic. That sounds far too big. But that transition away from clinician to researcher has definitely been something that I underestimated the impact that would have. And I see myself as a weaver. That notion of what I was advised on when I approached this work by the Kaumātua I work with, thinking of the skills and the techniques and what you bring to be able to weave whatever's needed for doing the different kaupapa, but importantly reflects those kaupapa Māori principles that I just spoke to, being non-Māori. And why is this important? Because these Indigenous methodologies, the approaches, they bring a depth that, in the words of the Kaumātua, are more vibrant and more living than just a static intellectual or fact-finding exercise. I understood research to be those static intellectual or fact-finding exercises until I moved across to work with the Research Centre, and I'm sure many of you have those experiences too. But the intention is to influence health system transformation. So still at heart, I'm a NICU nurse, but I'm motivated by what I've borne witness to, probably in my experiences as a neonatal nurse and in my early experiences here as a researcher. But I also want to echo what our team talks to, and particularly Dr. Lisa Edmonds, who's a Māori neonatologist working with our team. We want to be able to talk to how maternity care pathways here in Aotearoa privilege whiteness, but we need to be able to talk to and expose that privilege, use that exact language, be comfortable using that language, and understand that it's okay to create discomfort sometimes in the reader or the reporter, because things need to change and we need to nudge at that change. And it's not just maternity I speak to here. We're speaking to the experiences in NICU, in paediatrics, in many other centres around in our healthcare spaces. And I know that that's not unique to Aotearoa New Zealand. But it's also not all bad. My colleague Anna Adcock, in her final approach as her PhD, has highlighted there are culturally competent health practitioners practicing culturally safe care. They do exist. And she has been looking in the neonatal intensive care space, finding ways to improve and change the system for whānau who are experiencing NICU care. And they improve the NICU experience, they support whānau. And just as those healthcare champions are a way forward with a potential for scale up, I support the idea that there are, in the research setting, we need non-Indigenous allies to be working for and with research leaders who are Indigenous to bring about the change. And are these what Anne Bishop, who's an anti-racism trainer, an educator from Nova Scotia, describes as useful allies? So allyship in itself is probably a common and relatively well understood term, and there is quite a lot of literature around this, but my probably favourite description to date came from the conference we were at in December, which was with Dr. Kim O'Donnell. Describes we need more cheeky, effective allies. And so if cheeky, effective allies is the non-Indigenous working collaboratively together with Indigenous colleagues in a strength-based approach, I'm all for that. But there are potential shortcomings with both the use of that term, but particularly by people that self-use those terms. How do you identify yourself as an ally? Because often it can be utilised by those seeking redemption. It reflects the "I'm sorry for my colonising ancestors" rhetoric, which, if it's not carefully aligned with good action, is meaningless. And it potentially then confounds the problem, and it burdens our Indigenous friends and whānau with that white guilt and fragility. So accomplice is a term that some people prefer to use, and it can be indicative of someone who's working more at the structural level, but both are likely crucial to creating a more equitable world. And the ally characteristics are well published, and I've seen those reflected in the first 6 interviews I did as part of the master's study, but notably they all reflect some of those kaupapa Māori practices described earlier, in particular being humble, being careful, and a respect for the people. And the one that I probably struggled with the most, te reo whakarango kōrero, which is called looking and listening before speaking. And that particularly that notion of deep listening. I'm a talker, and learning to sit and be quiet and listen has been a big change for me, as is leaving problematic egos at the door, which we know sit well within our health system. But most importantly, it's not to ask more of those we work with, how do we make ourselves better allies? We know that. It's do the mahi, it's learn the history, take time in intentionally learning how to weave, as I've put it, sit in the necessary discomfort on your journey. And as Professor Yvette Rowe spoke at a recent conference, directed at probably wannabes and possibly active allies, know those doors you open as allies and keep them open. Know your places to let those through to lead, and only then do you follow. So despite my interest and I think what's necessary to talk to about what we bring to the table, what's the background, what's led us to this, I often reflect, I'm just thinking, what have I, no, I haven't missed, I thought I missed a slide, I don't know. I often reflect on my 12 years of working in NICU, and where I hadn't realized or appreciated until I left that space that I never in all those years heard the two very simple words, kia ora. Now I know very well what the weight or what meaning there can be behind those two words, which very simply mean hello, greetings. They can mean thank you. They have a range of meanings, but there was something that I never heard for anyone in our neonatal intensive care unit. I can't remember hearing them speaking in the corridors of the hospital. And understanding what void that left by us not even hearing that and being able to speak to it, not even being able, brave enough to work out if I could say the words correctly, really left an impression on me as I started at Te Tātai Hauora, Hine. But I acknowledge whilst there's a resurgence of Te Reo Māori, the language here in Aotearoa, we'll see it a lot more familiarly on the news. It's lots of words, lots of kupu are thrown into different conversation. It's not for everyone, and there are tensions, and we have to acknowledge that. But also, more alarmingly, my experience as a NICU nurse and a charge nurse meant that I was witness to, but also party to, the removal of infants immediately after birth. I cried at the last one, I'm not going to do it this time. So NICU nurses were essentially indirectly exploited to remove babies, still babies, from whānau Māori. But we were advised to pretend that they needed ICU support. We needed to take them away from that delivery space, take them away from their whānau and their family, perhaps pretend they needed an examination, take them across to the neonatal intensive care unit where the doors would be put on lockdown, and the family would then be told that their babies were being removed from them. This wasn't something I really reflected on until I was involved in this work. And I think it's important for us to talk to and understand how we've all been part of the system that is contributing and worsening our outcomes. So motivated by our histories collectively, our own personal histories, and the racism that plays out every day, it's my why of why I'm here, possibly talking to just a few people, but I hope it's something that can be used in a way that helps ensure the necessary change occurs. So thank you, ngā mihi, for listening. But to conclude, I just want to read a brief segment from a piece published just a few months ago by Māori activist and scholar Tina Ngata. You would all sadly know of the Christchurch terrorist attacks some years ago. And this piece followed Tina's speech at an annual meeting hosted by the New Zealand government that came about following the Royal Commission of Inquiry, in which meetings were recommended to build relationships and share understandings about countering violent extremism and terrorism. And Tina told the hui that if the Crown really wants to tackle terrorism, then it must start by confronting colonialism first. We cannot stand in solidarity unless we respect each other's experiences and how those experiences inform our interaction. This involves sitting with and reckoning with deep necessary discomfort. The age of colonial domination is drawing to an end. What we have now in our hands is the opportunity. We're ready for the conversation. And as Tina Ngata asks, the question remains, are you? So ngā mihi, thank you for listening. I can't miss the opportunity to share photographs and heartily thank those who have supported me on this journey and informed the mahi that I'm doing, all pictured here, the Kahui Kaumātua, the Molly Wardaguga Research Centre and Te Tātai Hauora Hine. Ngā mihi.
Thank you so much, Fran, for your vulnerability, your insights, your wisdom, your challenges that you've put to us this afternoon. I'll let you get your breath and sort of let's shake it out. And I'll open it up to the participants to pose any questions that you'd like to ask Fran. Whilst we're sort of bringing that together, Fran, you made a statement how we're all part of a system that is hurting people. And you talked about your realisation. What was that aha moment for you? You talked about your experience in NICU and being part of a system.
Mm-hmm.
When did that sort of hit you?
It's interesting. I don't think it hit me as early on as it should have. I definitely didn't realise I was part of that system whilst working there. I made that kind of joke about wanting to, you know, step away from 12-hour night shifts. And that was, as a mama of 2 young girls, I was looking forward to doing something with my skills and experience in neonatal intensive care. I was passionate about social injustices, but I don't think I understood the inequities in Aotearoa New Zealand until partway during my experience as a NICU nurse in Wellington. I had the opportunity to spend 6 months in Dumaji. And that experience working in Dumaji for me made me open my eyes and my husband's eyes when we came back to Aotearoa and realized this was playing out in front of us, but we hadn't seen it. And I think that probably heightened my interest to work in a research centre working under Bev Lawton that was looking to nudge at change. But I'll be really honest, I didn't understand the change that it was really looking to make happen until I was in it. And I think it was probably even some years before I really understood. I've been in this system, I've informed this system, I'm part of this system, and I don't know how we change it unless you're undertaking that type of work that can inform policies and ensure that good practice is protocolized and that everybody gets offered best care. And some people require more care, and that's okay. And I made those 2 comments around, for me, it was like a little light bulb moment where I one day realized I walked into the centre and someone said kia ora, and I thought, I have never heard that spoken. And language is so important. And I know we are fortunate in Aotearoa, if you like, we have one language of Māori that is used across all peoples in the country. And that creates a bridge, but there was no opening for that. There was no warm invitation. There was no one saying, I acknowledge who you are and I'm here and I'm on a journey. That for me was really big.
Thank you very much for that, Francesca. I know that Professor Beverly Wharton's on the Zoom here. So I'm going to just sort of invite her as the director of a research centre in the sense of recruiting allies to her team. Bev?
Oops. Thank you, Yvette. I'm just having a quiet hi. Kia ora, everybody. Thank you, Fran, for that lovely presentation. I mean, we need allies for a number of reasons. Fran's very good. But I don't know about yourself. We don't have a lot of specialists in the area and the leadership and those areas that we need in those health areas. So we need to recruit allies like a neonatal nurse, and we need to train and replace them for our workforce. And we're actually going to bring on a Māori neonatal nurse. And so that's that sort of bringing through. And so in that respect, I think allies are very important. And for us, having our elders to actually help us to recruit, they'll be there when we have our recruitment interviews, when we do our advertising, and they advise us, and they're part of the recruitment panels. So to be able to have that sort of, get that right person is really important. But I think we need to make champions, because it's champions, I don't know if you found that, Yvette, it's champions that lift that way through that ceiling, and that happened for me. I had a professor, a Pākehā, a white professor, who permitted me to do that research, permitted me to do research for Māori research. And it's very sad that not only is it a white person, but it's a male, but they're champions, and we must support them and value them. And I think that's where we come with our allies. I don't know if you've had that experience, Yvette, that we're walking with, and that there is some universities, there's a lot of permissions to have that walking with, and we become the problem sometimes. But for us in our universities, often it's not Indigenous as our leaders.
Thanks for that, Bev. Fran, do you want to just stop sharing your screen for a minute?
Yeah, silently trying to do that.
Okay. And I might actually, this is a really rare moment. I'm going to actually invite the non-Indigenous colleagues, and this is such a rare moment where I'm going to actually allow you to privilege your experience, because there's a couple of things that happen that I know from students and colleagues is that how do I move into a space and do I have a place? And I think that's the stuff that Fran was sharing about, that being uncomfortable, but realizing actually I'm supporting a system that's doing so much harm. Would one of the participants like to comment on that? And on how to be safe. Fran, would you like to comment on if you were inviting a non-Indigenous person to come into that space? What are, you talked about 3 things about being humble, humility and things like that. What are some of the other lessons that you'd like to share?
I think this wasn't even just being a non-Māori in that space, but it was that way of working, kaupapa Māori research, kaupapa Māori approach. And I've observed other people doing it. I think the biggest thing, that whole thing around the watching, looking and listening, it was learning and following people such as Bev, Fiona Cram, others that I've worked with, as to how they bring their expertise to a space, but doing it in a very respectful way. And I think that translates to the allyship as well. It's about learning, do you have something to contribute? And if you do, how do you do that in a way that's appropriate without looking like you're another Westerner that's put yourself in the middle, who's speaking the most and speaking the loudest? And I speak a lot, and I do death by emails all the time. So I know that that's something that I really have to pay attention to. I think the allies, possibly on their journey of becoming allies, have been used to being allowed a voice, have had those doors that they're able to open, and it's paying attention to the privilege that is with you, whether you like it or not, and learning to be understanding of that. So you don't cry often, which sometimes I do, but understanding that if you do get emotional about things as well, understanding where that emotion comes from and utilizing it, target it for other change.
I'm going to invite Dallas all the way up north, as she almost panics at the thing. And I know that Dallas has had a long connection with research at community level, at a state level, and have seen people come and go over the years. Dallas, as a person who's been a leader and trying to get good research in community, what else would you like to make a comment about Francesca's presentation?
Thanks very much, Yvette, for that kind invitation to make comment. Fran, thank you for your presentation. I think it's really important, as you say, Yvette and Fran, to have that relationship building between Indigenous and non-Indigenous researchers. More so for us in Australia, it's that having a reference group or an advisory group that is predominantly Aboriginal, so that you are getting the worldviews and the methodologies right, that you're getting the that you're getting the transcripts back right, that the intent of speech is interpreted, is translated properly. I guess for me personally, more and more I'm seeing now that we're not seeing conferences and presentations around Australia the rest of the world, where it's a non-Indigenous presenter presenting work that was done, you know, with Aboriginal people. There's that two-way presenting, and rightly so. In the past, it was always, well, there's only funding to send one person, so therefore it was always the Indigenous person who didn't get to go. So I think that having this balance now between two-way learning is really, really important, and I think the more we do that, the better we'll get at it. Thanks very much, Yvette.
Thank you. Probably that's just the last comment, Fran. Capacity building. How is your capacity as a researcher, as a scholar, as a clinician? How is your team? What skills, attributes have you gained during your research experience that you can't find in a textbook? It's actually got to be lived experience.
Gosh, excellent question, Yvette. I mean, it might reflect what I talked to about, that idea of you're in situations which are quite unique. And you will find yourself in situations where you have to sit in that discomfort that I spoke of before. But it's understanding why you're there and why that discomfort perhaps exists. And I think something that I maybe should have mentioned before as well is also learning in the, when you do it, when you've got it wrong, learn from that. And what is it that you've got wrong? And how was it handled, and how could you do better next time? And something that I might not have alluded to as much, but I'm in a unique position because I'm not out there acting or operating on my own. It literally wouldn't happen. It isn't for the support of Bev, for example, you know, saying, well, I want a neonatal nurse as part of the team, and there was no Māori neonatal nurse who was applying for that job at the time. But putting me and supporting me to be working alongside the Kaumātua, Yvette, who you know, Matthew and Charlie, who've been a huge influence. And actually, I wouldn't be doing this if it wasn't for the kind encouragement from Matthew Bennett in particular, saying, you know, there is a space for this type of work. And as Bev said, maybe his words are wrong, but not we need allies, but actually more can happen with more allies working alongside and for Māori than just for Māori on their own. How do we do that? And I think in terms of what have I learnt, Dallas, your comments around being at conferences and how those operate, I have to say that Best Start to Life conference you hosted, Yvette and Sue, was probably the best we've experienced in many, many years. That was how you undertake a conference. But I would never speak, whilst I'm speaking to this, if you like, on my own. I'm just lucky that some of the team have really annoyingly jumped on and made me nervous. I would never be able to talk to the work to date. For example, He Koro Waimanaki, the pregnancy wraparound study, all the other work we're involved in. I would never present on that work without Kaumātua in particular alongside me, because they're the ones who've enabled me to be here.
Thank you so much, Fran. Again, there's lots of congratulations and appreciation in the comments. You know, like I said, you've stepped out, you've allowed yourself to be vulnerable. You've stood in the light and says, this is what I've learned, this is what I've gained. You've shared your wisdom, your courage. And I know that, you know, the relationships we've had with our centres has always been constructive and uplifting. I want to thank you personally for stepping out there and sharing not only with Indigenous but also non-Indigenous colleagues that hopefully heard your message really loud and clear. We wish you all the best. And for everybody else, thank you so much. If you've got some feedback that you would like to give us, you've got an email address there, and we will provide Fran's email address if people would like that to give her feedback personally. But again, Fran, from the heart, thank you very much for your time this afternoon. And thanks again, Bev, for allowing her to present. All right. Good afternoon, everyone. Bye.
Bye-bye, everybody.